Now let's proceed to painful obstruction syndrome or the P syndrome. Let's welcome Ma'am Darlene. Okay, what is P syndrome?
Um, P syndrome are the localized discomfort in the muscles, joints. This means the obstructions involving chi and blood.
What are the four major types of P syndrome?
The four major classifications are the wind P, the cold P, the damp P, and the heat P.
How do you define wandering P? What is wandering P? Wandering.
Wandering is the wind P.
Mhm.
This the wind predominates. It's a wandering pain that moves around the body.
So it's migratory,
Yes,
wandering.
it's moving around the body. It's migratory.
Okay, can you tell us the tongue picture of somebody with wind bee or wandering bee?
Come again, Doc?
What is, can you tell us the tongue picture of somebody with
Oh,
wandering?
the tongue picture of the wind pea is a normal with a thin white coat.
Okay. Okay, what about painful bee?
Um, painful pea, or this is the cold pea. It's the predomination of cold pain that is sharp and contracting.
So the chief symptom is severe or stabbing pain.
Yes, po, Doc.
Okay, so this is mainly caused by,
This is mainly caused by the chief is by the cold.
okay. So the only way that you could tell this is painful pee is what do you do when you apply cold or hot compress?
Hot compress
Hot
po.
compress, it gets relieved. Okay.
Yes po.
Now let's talk about fixed pee.
Um,
What is the chief symptom here?
this is the predomination of dampness, where the chi and blood flow black by damp.
So how would you be able to tell that it's damp?
Pain feels weighted. It is heavy and waterlogged and fixed. So the range of motion is reduced.
Okay. Like obviously since this is fixed pee, so it's so easy to localize the the pain. My next question is, how are you going to determine if it is really fixed pee or caused by pathogenic dampness? What other features are you going to look for in the pain area? You mentioned that it is caused by dampness. So how do we confirm? By just looking at the pain area. So you will be
The pain area is yung namamaga siya, Doc.
there will be swelling, there will be
Yung swelling. Yes.
numbness, heaviness. Actually, yeah. Let's go now to hip P.
Heat P or hot P is a damp a damp gives rise to heat. So the damp heat signs will predominate. It's signs of inflammation, the redness and swelling, and heat and pain.
Okay, so how are you going to differentiate fixed P from hip P? Just by looking at the pain area.
The damp gut swells, and damp heat is swelling and red.
Okay, redness and swelling. What is your treatment principle for wind P or the migrating pain? How are you going to treat migrating pain or wind P? Yes.
Um, I will expel the wind, cold, dampness. I will unblock the channels.
Okay. What about cold
Um,
P?
I will definitely warm the channels for the cold, expel the wind, cold, and dampness.
Will you be considering doing moxibustion here?
Definitely, doc. It will help
What about
get
dumpy?
rid of the cold.
How do you
Dampy,
treat dumpy?
I will expel the dampness and the wind cold and unblock the channels.
And dump heat P.
For the damp or heat P, I will clear the heat, unblock the channels, expel the wind and the dampness.
Okay, thank you very much.